This is just an absolute pleasure to have the opportunity to not only introduce a clinical psychologist, Dr. Cheatham-Johnson, but someone who is a alum of the FIU program. And I didn't ask when you signed on, were you one of the first students to enroll in the clinical science program when it was first started?
I believe my cohort was the fifth cohort.
Fifth cohort, okay, so you
Yes.
were maybe before students had cycled all the way through
Yes, I
and
think,
graduated.
yeah,
So,
when I started, we had our first class going up for internship.
okay,
Yeah, in the
so
first class.
so we can include you as one of the founding members of the clinical science program, and certainly we're very much looking forward to your perspective and your thoughts, and hopefully some discussion today. So hoping that everyone will have some questions and some contributions as we go along. So without further ado, the floor is yours, and looking forward to the talk.
Yeah, thank you. Good afternoon, everyone. I believe you're an hour ahead of me in Miami. I'm in Texas right now. I don't have anything like formal slides or anything prepared. I really just wanted this to be an organic conversation around my individual journey, and sort of the thought processes that I had along the way and how I ended up in my current role. So I'll just start by talking about my background, my journey, which started at FIU in the clinical science program, through internship, fellowship, and now in my current role at Children's Health in Dallas. So my grad advisor was Dr. Katie Hart. So I was a member of the School Ready Lab. I remember brainstorming that lab name with Bridget Poznansky, who came in the year after me. I believe I still have the notebook paper where we were trying to come up with acronyms in the cubicles. So it was fun thinking about those early School Ready Lab days. But I was a part of the SREP, and Summer Academy, the development of those things. So all of my training background was in the development and evaluation of community-based interventions for children at risk for externalizing behavior problems. I had a great time in both of those programs just because it allowed me the opportunity to immerse myself in the Miami-Dade County community. And build those partnerships and develop my specific interests, which started as interest in the engagement and behavioral parent training programs. But throughout that time, I started to sort of think about where I could see myself outside of graduate school. And it started thinking about like community mental health and really thinking about different populations, and where families typically go when they are seeking behavioral health care. And I know later on, I found out on internship that it was really the overutilization of emergency departments in medical settings. So families were not coming to places like the CCF or outpatient community mental health centers. They were really going to their primary care physicians, their pediatricians, and sometimes the EDs. And so as I moved towards internship, I really wanted to seek training that would give me the opportunity to develop some skills working on multidisciplinary teams in medical settings, and to further develop sort of my exposure or understanding of multicultural psychology. And so I had the opportunity to be matched at the Multicultural Clinical Training Program at UCSF. And I don't know if you all are familiar, but there are only two multicultural clinical training programs in the entire country. One is up in Boston, and the other is in California in San Francisco. And so I was very fortunate enough to match at the MCTP in California, where I got amazing training on really focused on multicultural psychology, hospital systems, critically examining hospital systems, and how to identify and dismantle barriers to care for historically marginalized populations as they navigate seeking evidence-based behavioral health services. And in addition to that, also there's a strong emphasis in the multicultural clinical training program on advocacy and in integrating social justice into our roles as mental health providers, which was very transformative for me. just having all of my background working in Miami-Dade County throughout graduate training. Also during our internship, most internships have like a capstone project that you have to complete at before the end of the training year. And my capstone examined sort of the inequities in the referral process to specialty mental health care for Black youth. And so that was a great opportunity partnering with the integrated primary care physicians to examine that data and the ways that they can improve those systems of care for Black youth in San Francisco. But obviously, my internship training was significantly impacted by the global pandemic, COVID. So a little over halfway into the training year, we were told that we couldn't return to the hospital. So I always consider myself a part of the original quarantine class of 2020, where we were trying to shift everything toward telehealth and figuring out how to best care for our families during a crazy, crazy time, while also trying to finish my dissertation and having lots of phone calls with Kat about how I was going to manage doing this. Fortunately, I was able to successfully defend my dissertation before the end of fellowship. But COVID and all of what came with COVID, as far as what was happening in society, the police brutality, all of the injustices that were going on, really set the backdrop for continued conversations around the importance of our roles as providers and how we serve populations and how we provide quality trauma-informed care. And so while COVID was terrible, it really lended itself to continuing to inform what my vision was for myself when I completed my training. So I was applying on the postdoc search, and I was applying to different postdocs all over. I was trying to actually stay in San Francisco and continue my studies there, and I ended up applying for the APA Minority Fellowship Program, the postdoctoral track. Unfortunately, my proposal wasn't awarded, but I did receive an honorable mention designation. But I ended up finding a great fellowship with Dr. Dustin Sarver in Mississippi on his SAMHSA funded grant called BHIP, Behavioral Health in Infants and Preschoolers. And BHIP essentially was designed to create or develop a continuum of care for high-risk infants and toddlers in Mississippi. So starting in the NICU and extending to their outpatient clinic. And BHIP had a bunch of different arms, but what attracted me to BHIP wasn't moving to Mississippi, especially from California, but it was the idea of being able to gain valuable research on how to develop a system of care in a state that lacks resources across the board and ranks 49th or 50th in all social determinants of health. So when you think about the opportunities to make an impact, the opportunities to design systems of care and develop interventions that meet the needs of our country's most vulnerable populations, I think that was very appealing to me, especially at that stage in my training and my development. So I joined Dr. Sarver and his team in Jackson, and I really like the fact that my fellowship training wasn't like a cookie cutter, one size fits all. Like I'm a part of a cohort, and they have the same training opportunities every year and the same rotations. My fellowship training was really tailored to meet my professional needs, and that was something that Dr. Sarver is really good at as far as mentorship, is helping you figure out your next step in developing sort of benchmarks to get you to that point. So when I transitioned to Jackson, Mississippi, my role included a couple of different things. The first was providing developmental evaluations in the NICU's high-risk follow-up clinic. So once a child was graduated from the NICU, we conducted Bailey assessments with the children and made sure they were connected to the developmental therapies that they needed. And then those children were followed in our outpatient clinic once they aged out of the high-risk follow-up clinic at 2 years of age. We also routinely screened caregivers for adverse childhood experiences, both the caregiver and the child, recognizing that relationship with neurodevelopmental outcomes for children later in life. And then once children transitioned out of the high-risk follow-up clinic, we continue to provide those developmental evaluations, but also offer dyadic intervention, so PCIT and child-parent psychotherapy. And I received my rotation and internship allowed me to become rostered in child-parent psychotherapy because my rotation was at the Child Trauma Research Program, spearheaded by Dr. Alicia Lieberman. Also, I had the opportunity to provide behavioral health support to caregivers during their child's NICU stay. And I know maternal mental health has become increasingly gotten a lot of attention in recent years. Mississippi has one of the highest preterm birth rates. It's about 17%, and the national average is 12%. And particularly for Black women, the preterm birth rate is 20%. So there's a lot of movement and awareness and appreciation for maternal mental health. So I had the opportunity to do that. And then another arm of BHIP was to increase early childhood interventions across the state, because UMC, where I was, is the only academic medical center in the entire state of Mississippi, and it's the only level 4 NICU. So we had a lot of families that were experiencing significant barriers traveling 4 hours or more to make their developmental evaluation appointments and for their children to receive intervention services. And so Dr. Sarver was really passionate about identifying community mental health centers across different regions to be able to train community mental health providers in those early childhood interventions. And our intervention of choice was PCIT. And so I had the opportunity to help him sort of identify community mental health centers across the state who would be able to, who would be interested in partnering with us to train their clinicians. So I got a lot of exposure to like statewide dissemination and implementation, and a little bit of policy exposure as well. And then in my second year, I actually reapplied for the APA Minority Fellowship Program and was awarded to fund or support my second year of postdoctoral training to continue helping with disseminate PCIT across the state of Mississippi. So that was really cool because it allowed me to have more autonomy over what I wanted to do with my second year of fellowship training. And a part of that was me getting more exposure to integrated primary care, behavioral health support. So I had some clinic time at the primary care clinic that was just across the street from the hospital's main campus. And then 2 years flew by and it was time for me to start looking for jobs. And at that time, I realized that I really enjoyed working in an academic medical setting. I really liked the pediatric space. I hadn't had much exposure to peds specifically before my fellowship training because at UCSF, we were embedded within the hospital, but it was more so of a community mental health center embedded within the hospital system rather than a pediatric psychology clinic. So I knew that the most things that were important to me were being able to continue to serve vulnerable populations, to be able to be in an environment where I could continue to infuse principles of health equity and equity, diversity, and inclusion in my work. And also policy and advocacy exposure. And so I applied to a couple of different places, about 3 or 4 positions, and interviewed at all of them. And I ended up deciding to come to Dallas, where I am a pediatric psychologist embedded within the hospital's heart center. So I'm in the cardiology service area. The funny thing is that my role in and of itself is very similar to what I was doing on internship, but instead of working with NICU families, I work with cardiac patients and their families. So again, as a psychologist, we wear many hats, we do many things, so no day looks the same, and I personally enjoy that. So a couple of things that I do are pre-transplant evaluations for children between the ages of 0 and 5. So these are children, the majority of them are born with congenital heart defects that require them to need a heart transplant. So I meet with those families at the bedside as a part of a very large multidisciplinary team that includes dietitians, pharmacists, spiritual care and education, obviously the cardiologists, financial counseling, and we all have time with the family to learn about them and whether or not to identify any barriers that would make listing the child for transplantation unsuccessful. And then we relay that information to each other and make a decision about whether or not the child should be listed. I continue to conduct neurodevelopmental evaluations for our cardiac patients through our early childhood clinic. That is, again, the Bailey, and then as they get older, the Whipsy or the Mullen. I'm also involved in our fetal heart program. So when a birthing person, a mother, a caregiver, learns that their child will be born with a congenital heart defect, the fetal heart team reaches out to me to provide neurodevelopmental counseling on the neurodevelopmental implications of their child's congenital heart defect and what common delays we see in our cardiac patients, and then talk about the services that we'll provide as part of our program. And then a pretty big chunk of my role is to provide perinatal mental health support to families at the bedside during their child's hospitalizations, because quite a bit of our children that are inpatient and admitted are waiting for a heart transplant, particularly the children between the ages of 0 to 5. They're waiting in the hospital for, on average, 4 to 6 months, sometimes longer, up to a year. And obviously that's a lot of strain on a family. It's particularly if the parent is parenting multiple children or has to return to work. And we know from the literature that about 20% of moms experience postpartum anxiety, depression, and 2% of fathers as well. And so my job is to help caregivers, whether it's mother or father or other caregivers who spend a lot of time at the bedside, process and cope the stress that's associated with their child's diagnosis and hospitalization, and provide like brief CBT for them. And I also provide interventions for our older patients as well. A large part of my role that I was pretty transparent about when I was in negotiations was wanting to have dedicated time for program development, to systematically examine and improve outcomes for patients and families. And that has resulted in me co-chairing our Justice, Equity, Diversity, and Inclusion Council. So it's a health equity focused council within the Heart Center. Myself and a cardiologist who's also new to the Heart Center have come together to develop a mission and an organizational structure so that we are constantly thinking of ways that we can provide equitable care for our patients and families. And our first QI project is to examine perceived expectations in caregiver engagement in their child's care, just because over time we've noticed that implicit biases, we all have them, but there have been trends in how families are viewed, whether or not they're maybe judged based on how often they can be at bedside, and how we think that that could potentially lead to different outcomes in their child's care. So that's something that's been really exciting and an initiative that we've pushed out and officially launched a couple of months ago. And we're collecting data from our caregivers through surveys as well as the medical staff. And I'm hoping that we have enough responses to be able to identify the ways in which we can improve care for our families. So I'm gonna stop talking because I feel like I've been talking a lot. But that's sort of the last 10 years in a nutshell of how I've sort of ended up where I am now. But I'd like to open it up for questions. I have some notes to my right of like some pearls of wisdom that I think would be helpful. But I'd like to take questions and see where the conversation goes. Please ask questions. I want this to be a dialogue and not me just talking.
I think something, hey Randy, I think something that is pretty explicit in our program, right, is especially as it being organized as clinical science, is a lot of there's not much discussion of, potential career pathways that we can take that undertake clinical, going the clinical route as opposed to a more research orientation. So I wanted to hear your thoughts on that, right? So generally speaking, did you already know that you were gonna, take the path of going more to, pursuing a career that was more clinically oriented as opposed to research oriented, or I just wanted to hear your general thoughts around it.
Yeah, I really appreciate that question. So I have a lot of thoughts on, and this is not just specific to FIU in our clinical science program. Over time, I've met students, whether they've been my intern cohort mates or on fellowship, that there's always like that similar thread of sort of the pressure to take a path that leads you to an R01 institution where you have your own lab and you're taking grad students. In full transparency, I know I'm being recorded, but there was a little bit of finessing that I think myself and many of us have to do when we're applying for graduate programs, where we see the benefits of acquiring the skills that a clinical science program equips you with. But knowing that you're not necessarily going to have the same career trajectory as your graduate advisor. I think I was a little, in my case, specifically working in the school ready lab with Kat, in knowing like her program of research, I think there was enough overlap that it worked for me, or it served my needs, and I hope that it served her needs too. But I do wish, and I hope that moving forward, that graduate programs provide more exposure for students who don't necessarily see themselves one way. And I think the way that larger society is moving, like we need more than just one type of psychologist, and we need psychologists in more than just one type of space. Does that answer your question?
Yeah, that was very helpful. Thank you.
Yeah, I will say that I was told in my first or second year by a former faculty member that I wouldn't know what I would want to do until I was on internship. And I think it could have been that that was his experience. But I also think that when I was going through FIU's program, there wasn't a lot of external practica placements. I think there were only two. It was Nicholas and it was the Mailman Center. So there wasn't much exposure to what you could do outside of those two placements. But I would probably caution people from waiting until internship to figure out what they wanted to do. I think now there are more opportunities to network and reach out to folks in other industries with similar training to figure out what other options might be available. I know for me, when I was applying for postdoc fellowships, I started looking at some placements will list where alums have gone and what industries they're in. And I remember going through a list for one site in particular, I think it was UCLA, and one of the alums, Dr. Leandra Clark Harvey, her role that was listed was the chief policy consultant for the California State Assembly. And she is a psychologist. She has a doctorate, like she has the training that we have. And so I thought that was amazing. And I actually reached out to her, had a conversation with her, just like sent an email randomly, hoping that she would respond, and had a conversation with her about her path to get to the California State Assembly, which I think is amazing. It is now like one of the roles that I'm like, okay, maybe in 5 to 10 years, I should be working towards that. Because I think that we have extremely unique training, training experiences and backgrounds that why shouldn't a psychologist be in a position to inform policy that impacts the lives of people, particularly those that are seeking behavioral and mental health services? Like, why should we not be in those spaces? That was a good question, though. Any other questions?
Hi, Randy. I'll continue with the school ready questions.
Okay.
I think one thing that I've been thinking about is like balancing where you already have training in and your like current expertise with then seeking out new training opportunities. So like I'll be applying to internship next year, and I've been given the advice that with our lab's background, like looking for sites that have an early education focus would be advantageous to me and like my fit with them. But I am also someone who hasn't received a lot of any pediatric training really.
Yeah.
And so it's something I'm interested in an internship. And so like this tension between when you're applying to things, like setting yourself up for success and applying to things that like you're ready to run on internship, but these are supposed to be training opportunities. And so I was wondering if you could sort of speak to how you went about navigating like the tension between those two things.
Yeah, this is something that I also experienced when I was going out on internship, mainly because I really wanted formal trauma training, which I had none. And it is a very delicate balance, because from the internship training director's perspective, it's hard to take a risk on someone who has limited or no exposure, versus someone who comes in and they do. The best way to answer this is to make sure you have a combination of training sites that you've identified that are a little bit more safe, and others that are probably more would allow you to get the training that you want, but maybe necessarily don't have the background going in. And then I would also say to make sure you're able to thread the needle when you're tailoring your application materials, that you're able to demonstrate that while you don't have the pediatric background per se, that you have a very unique set of transferable skills that lends itself to the pediatric population. I had no cardiology training background at all. I'm still learning the different types of congenital heart defects and the types of medications and their impact on neurodevelopment. So I think, and that was something that I was a little bit apprehensive about accepting my current role. And even in Mississippi with the NICU, I had no idea about, what the premature brain, how the premature brain is different than the typically developing brain, and how that translates when you're testing a premature child and correcting for gestational age and all of those things. But the fact that I had a strong background in early childhood mental health and was the expert in the risk for externalizing behavior problems and things like that, I think that was my background in that way lends itself to my work with families, even though, I didn't come in with a bunch of pediatric experience. Like PCIT is going to be PCIT regardless. Well, I am actually thinking about piloting PCIT for cardiac patients, because I don't think it's been done yet. But essentially, like, those things the principles are the same. You just might have to tweak some of those things. So yeah. And in full transparency, when I went out when I was applying for internship training, I definitely only applied to places where, like, trauma training or, and I probably did myself a disservice. It ended up working out anyways. I did not match in the phase 1. But like I said, multicultural clinic training, MCTPs were where I wanted to be. I did not get an invitation to the multicultural clinical training program at San Francisco in phase 1. I did in phase 2. I matched there in phase 2, and they only had one open position. And then they also wanted to offer me a job as faculty psychologist. So don't let any of the match process, like, determine your worth as a psychologist or your potential impact in the field. It's just a hodgepodge. But it always works out the way that it should.
Thank you.
Just saying, the School Ready Lab is really doing well with these questions.
I guess I'll keep it going. Wow, it has to come to me. I'm thinking, so I'm in my second year, so all of this is like super in the future for me, although I know it's gonna come eventually. What advice would you give to yourself, like in the midst of the program, kind of like trying to go through your milestones and just in the thick of everything?
Ooh, that's a really good question. Grad school is tough. Grad school is really, really hard. And I don't think that it can feel like a lot of times that your value is only tied to your benchmarks and your productivity, because it's such a long, arduous process, and you're there for 5 to 6 years. And so you kind of have to, sometimes it's maybe indirectly communicated that you just have to put your head down and get through. But we have lives outside of graduate school, and families, and things happen. People lose family members, people's family members become sick. And those are all things that, can change, like, your views on, pursuing the path that you're pursuing. Or, so the things that I would tell myself, I don't know, the first 2 years were rough for me. So, I would say I would probably have pushed myself to fill my cup outside of graduate school. So do things that made me feel good about myself, whether it was being involved in the community. Later on, I volunteered out in the community. I was a mentor for Girl Power Inc. And I really enjoyed that, but I wished I would have done that sooner, built a community outside of, like, my cohort, outside of FIU, outside of graduate school. I wish I would have done that a lot sooner, because I feel like it was helpful in the second half of graduate training, but it would have been helpful in the beginning. To know that to not feel the pressure that rest has to be earned, taking a break for yourself has to be earned based on benchmarks. What else? Yeah, I think those are the two. Yeah, for sure. Those are the two.
Yeah, I definitely hear the earned rest one. I'm like, but I didn't do anything. It's like, no, you still.
Yeah. Yeah, it's definitely, and it doesn't even have to be explicitly communicated, but I think it's just that pressure of, like, I have to be doing something, and if I'm not doing something, then I'm a failure. And I really hope that as things shift, that graduate programs do a better job of looking at students holistically and not just based on, I know that APA has metrics and accreditation, you know, is a real thing. But Dr. Tama Bryant, I was invited to APA's second racial equity think tank in June of last year. It was an amazing opportunity. I met people from different industries all over the country. And that prompted me to be more involved in APA because I think it's shifting in its efforts to be more inclusive of professionals outside of psychology and formal psychologists. But in her opening remarks, she said that we are doing a great disservice to graduate students if in the process of matriculating through our programs that they lose themselves. And those words really resonated with me because there are a lot of changes that I went through in graduate school to get to where I am today. That I just feel like it's important to make sure that we're looking at trainees holistically and not just seeing them for their benchmarks and productivity. Like there were things that I feel like I contributed to the program that filled my cup more than submitting a grant in my third year. It was creating or helping to create Black Graduate Women's Association. It was having conversations with Stacy about the need for a diversity committee, which I've learned has shifted and it's more like a departmental thing, but things like that were really important to me in grad school and have informed like what I'm doing now with the Justice, Equity, Diversity, and Inclusion Council at the Heart Center. And so those are the things that weren't like my master's or my comp paper, but they were important to me and they fuel my desire to continue to provide what I hope is quality behavioral health services and navigating systems of care and being a better advocate for my patients and their families. So yeah.
Randy, there's a question in the chat from Allison.
Oh.
She's asking, when do you recommend to start applying for postdocs and how did you find postdoc opportunities? She's heard the advice to monitor listservs, but is wondering what other methods you've used.
Yeah, so I did a combination of both. So I applied to more formal postdoctoral fellowships that were listed through, was it APIC? But then I also monitored the listservs. And I also had former faculty members send me opportunities that they thought would be of interest to me. So I would probably say a combination of those three, reaching out to mentors or faculty, or even cold calling people that you maybe see online and saying, hey, I'm, getting ready to apply for postdoc and interested in any opportunities that you might have. It's funny, actually, Dr. Miguel Viotas actually sent the listing for my fellowship placement in Mississippi. And I looked at it and I laughed and I said, there's no way I'm going to Jackson, Mississippi. And then I ended up in Jackson, Mississippi. I would also say that has been a big advantage for me is that I've never been afraid to go I was afraid to go to Mississippi, but for the most part, with the exception of Mississippi, I've never been afraid to go somewhere new, different. I know that I was in a position to not have like any family demands or stipulations or constraints on where I went. And I felt like that's been a big advantage for me because systems of care look very different in different parts of the country, and being able to have that diverse perspective on how things are done and how you can improve them within different populations, within different settings, within different regions, I think was a strength when I was applying for internship and then postdoc and then my current role.
Hi, Randy. This is Anit speaking, camera off. I have a loosely structured open-ended question for you.
Okay.
So I'm a first year, so I'm still very early on in the game. Um, and I hear you talking about your career, and it's so exciting.
Oh,
But then
thank
you
you.
take the moment to reflect that like that took like 10 years. And even though I'm already here, like in my first year, um, there's like two messages being delivered to me, which is both your career has already started, slash, don't worry about it. You're still just getting started. It's okay to change plans and interests. And I'm someone that I have a hard time seeing myself on either side of the binary of research or clinical work. So, cool, like the direct question is, how do you suggest we nurture or don't feel discouraged to be that malleable student that doesn't know exactly which side is the most fulfilling, and the fact that like our program is very milestone oriented, it feels like we're constantly being pulled in a direction. So I think I'll stop there. It's like a loosely structured open-ended question. Anything you share will be beneficial.
Okay, I'm gonna repeat this back so that I have a good understanding. Is
Yes.
you're wanting to know how to seek out opportunities that help you develop a clear path of where you see yourself?
Yeah. Why not? Yes, let's go with that.
Okay. That's a really good question, and I feel like I am, I feel like it hasn't been that long, but I'm approaching 4 years post FIU, and maybe at 5 if you include internships. So I'm not sure the changes that have been made within the program and what opportunities are available. But I would say, one of the things that I did during graduate training that was like external opportunities to help me figure out what I was interested in, what I was not interested in, were like APA has like the Psychology Summer Institute. I also went to Stats Camp one summer at Michigan State. Little opportunities like that provided me the opportunity to network with other attendees who sometimes were for like early career professionals or other or just more advanced or further along in their processes than me, to be able to talk to them and build connections in that way. Also exposing me to the fact that I knew that I did not want to be a hardcore researcher because stats camp was a little bit intense for me. But yeah, I would say seeking out external opportunities that you can apply to. Summer Psychology Institute, I highly recommend. Did you attend Sci yet?
No, I haven't been able to go.
Oh, okay. Yeah, I would say Sci is really good. If you are on the research side, Stats Camp. But yeah, I would seek out external. There are a bunch of different organizations other than APA that have like summer opportunities where it's like 1 to 2 weeks where you're able to like be exposed to different areas within the field and maybe build build a network that you could lean on later on. But as far as like within the program, I would say it's tough. Like when I was a grad student, it was tough because of the power dynamic to have fully transparent conversations without feeling like your status in the program was called into question, if that makes sense. And it's my understanding that students within our clinical science program have been very vocal about some of the things that they like and some of the things that they don't like, and there have been changes made, and I think that's awesome. I didn't feel like I had that voice. I think it's also important to identify external mentors. Like your graduate advisor cannot, well, one mentor can't fulfill all of your needs and be able to give you all of the answers to your questions. So I think it's really important. What has helped me along the way is building like a council of mentors in different spaces, in different roles across each of the institutions that I've been in to help me like guide me along the way.
Wonderful advice. Thank you, Randy.
No problem.
Oh, I do actually have another quick question, and I'm not sure how much light you'll be able to shed on this, but from recent conversations, I've heard many people talk about some informal postdoc opportunities to especially gain their hours necessary for licensure. I'm not sure if you are aware of any of these opportunities, but I think it would be worth at least having somebody speak to it.
No, I actually hadn't heard about this at all.
Mhm.
That's really interesting.
Yeah, in the capacity of right after you finish your APIC internship, seeking an informal setting to get those hours, right? So let's say that you didn't want to commit to a full-on postdoc, just
Right.
interested in learning more about that. But if you don't have much to share about it, it's all good.
Yeah, so I do know that there are a couple of people who were interested in that now that you elaborated that there are some private practices who have licensed psychologists that offer opportunity, like it's a fee. You pay them a fee to supervise you to get those extra clinical hours outside of a formal postdoc. So I do know that there are people that do that, and they're both on the doctoral and master's level for licensed clinical therapists. Yeah, but that's not something that I have much exposure to. Any other questions? I feel like it seems like you all are in different stages in the graduate program, but I encourage you to, whether you're first year or you're about to apply for internship or postdoc, that you think about like what's really important to you. Like, why was the reason that you even applied? I know for me, it was the ability to improve behavioral health services for historically marginalized populations, regardless of the presenting concern. So whether or not it was a child with a congenital heart defect, or it was a premature infant, or whatever, it was about the impact and being able to make as large an impact as possible. And as I'm still in the early stages of my career, I'm still constantly thinking about how I can get to the next level as far as a role that would allow me to make an impact on a larger scale. So I'm really interested in policy. And so I have been having conversations with the director of the Heart Center here in Dallas about ways to get involved with the American Heart Association to serve on a board or be involved in any of their initiatives to inform the policies and guidelines they make around mental health care within the cardiac patient population. So I think that has been sort of my North Star and helped me figure out how to navigate and acquire the skills I need to advance in my career. Thank you, Alina. And I also encourage you all to, I know that this wasn't heavily emphasized or talked about when I was in graduate school, but to become involved in APA, I know there was or other organizations, not just APA, but I say APA because I've had more exposure as an MFP fellow and now being invited to the racial equity think tank and becoming more aware of like the new EDI office and the initiatives that they're pushing out. They need current student feedback and input. When I was at the racial equity think tank, I was assigned to the curriculum and education work group, where I was at a table with people who were much further along in their careers than I was, and we were having conversations about how to make changes to APA's involvement in curriculum and education. Those are conversations that I think current students should be involved in. And I know APA recently released a notification about a bunch of vacancies on different committees across the association, and many of them encourage applications for current graduate students, not just professionals. So I really encourage you all to get involved in the association, and it could also provide opportunities to see what career pathways are available in the association for psychologists. APA is also on my list as a future job.
I think Elena had a question in the chat regarding engaging with policy in the past and what experiences were there.
Yeah, so my policy exposure has been I've had less, it's been a lot more limited than other areas that I've been exposed to. But I know when I was in Mississippi with working with Dustin, he was very involved with like local politicians in Mississippi in helping them like make them aware of the importance of early childhood mental health and the importance of these early interventions like PCIT and care, and got some assistance lobbying for some of the grants that he had in Mississippi and to be able to push out those things. I know from applying for internship and postdoc that there are specific sites that give you like concrete exposure or opportunities to be involved in policy work. I know specifically at Children's Health, Maurice Jones Center for Foster Care Excellence, their internship or postdoc, it might be the postdoc fellowship training has like specific policy training experiences. So mine has been a little bit informal and just within the nature of the work doing dissemination and implementation work in Mississippi. But I know SRCD, Society for Child Research and Development, has a policy scholars program, I believe, that at one point I was interested in applying for during graduate school, but I don't think I ever moved forward with that. But I've heard great things about SRCD's policy scholars program. And I think APA may have a policy program as well for trainees. I know we have about 5 minutes. I'm happy to, I can put my email in the chat. Feel free to reach out to me if you have any questions. I'm more than happy to talk.
Randy, I know you said you had some kernels to share with us. So I know within this last 3 minutes, if you haven't already shared them out, if you could just drop a few dimes to send us on our way this good Friday.
I think I had said a couple of them through. Let's look at my notes. Yeah, the biggest thing for me was mentorship and mentorship specifically outside of FIU in the program. Like identifying your North Star, your why, and making sure that you're seeking out training opportunities or educational opportunities that align with that. Rest is not earned. Seeing yourself outside of your program benchmarks. And then not losing yourself, I think, to sort of echo what Dr. Tama Bryant was saying about, you know, she said that a lot of times graduate programs indoctrinate students, and along that way they lose themselves. And so I would encourage everyone to not lose themselves as they're trying to, you know, get their degrees. And also, I think a lot of times, and Stacy talked about this all the time, competing demands. And I think program structures, not just graduate school, I'm learning this as a faculty psychologist, that are the systems, like academic systems, medical systems, many of our systems can prevent us from extending ourselves beyond self-interest, because it's like, oh, if I create this health equity council, or if I do more volunteer work, or if I do this, it's not a line on my CV, or that doesn't count towards promotion, or it's not going to be looked favorably upon. Anything that has been super impactful in our field has probably required us to extend ourselves beyond self-interest, especially if the goal is to meet the needs of vulnerable patients. And so I would just caution people from getting so bogged down on the competing demands that they're losing sight of why they got the degree that they were going for. And as Congressman Lewis would always say, get into good trouble. That's been my mantra as I've entered my career. It's good trouble. Advocating for a seat at the table, and making sure that the voices of those who don't have a seat are heard.
Well, thank you. We owe you our thanks for just a terrific hour of not only sharing your experiences and helping everybody get a sense of peeking around the corner of what things are going to look like maybe for them sometime in the future, but also the wisdom as well. Thanks a lot.
Thank you. Thank you for the invitation. Please feel free to reach out. T and I have had conversations over the years about where he sees himself, and I'm more than happy to extend the same opportunity for other students. You will get there. I know it doesn't always seem that way, but I'm living proof that you can get through it on the other side, and you can find something that you can pick a career that you find value in and that fills your cup.